right. Hello there. My name's Bill Warner, and I'm assuming you're 64 and concerned about going on to Medicare. Okay, so if that's not you, don't worry about watching this video. But this is what we go over with each one of our clients who are thinking about going on to Medicare. What's going to happen when they turn 65? So the first part I'd like you to look at is this where it says the government part of Medicare. The top part of this PDF here that I have highlighted, this is going to go over the government part of Medicare. Okay, so the first, this is called Medicare Part A and B. You sign up for this at the Social Security office in your town. You can do it on ssa.gov, or you can call the Social Security line to sign up for Medicare A and B. Okay, so the monthly cost for Part A is free. The monthly cost for Part B is going to be more than free. Okay, so most people are paying $185 for it. However, if your income's under 106,000, you file an individual tax return, you're going to pay $185. If you file a joint tax return, your income's under 212, you're going to pay $185. Okay, let's say your income is between 400 and 750,000, and you're filing a joint tax return. Well, you're going to pay $591 a month for your Medicare Part B premium. This Part B premium, it will be billed to you. If you're not taking Social Security, it's going to be billed to you in the mail. You're going to get a quarterly bill. If you are receiving Social Security, it's going to come out of your Social Security check every month. Okay. So what does the coverage do? Well, the first thing the coverage does is it's accepted by basically but most of the doctors in the United States accept this coverage. Primary care doctors, specialists, labs, hospitals. This is your largest network of doctors is Medicare. Okay, so don't be worried. By going on to Medicare doesn't mean you're going to lose your doctors. Okay, Medicare has a great network of doctors. Okay, and then so now what's the coverage look like? Well, with Medicare Part A, every time you're hospitalized, you have to pay $1,676, and they're going to pick up the rest. So that's for an overnight stay in the hospital. So that's a per occurrence deductible. That's important to remember. Okay, so I'm going to highlight per occurrence. Okay, and then we have Part B. Part B covers your doctor visits, your labs, your outpatient surgery, basically anything that's, urgent care, chemotherapy, durable medical equipment, medically necessary services. It's covered by Medicare Part B. Okay, that's going to have an annual deductible. That's different, right? Than per occurrence. So we have an annual deductible for Part B as opposed to Part A. It's per occurrence, and that deductible is $257 a year. Okay, and then after $257, Medicare is going to come in and pay 80% of the cost, and you are going to pay 20%. So there's 20% left over. So so now we've talked about Medicare Part A and B. What does Part B doesn't have a cap. So there's no cap on that 20%. And also there is no drug coverage. Okay, so if we have $100,000, chemotherapy bill, God forbid, but if we do, we're going to be on the hook for 20% of that. So we'll have to pay 20 grand. Okay, so how can we get a cap on this, and how can we add drug coverage? Well, you have two fundamental options, and now we're going to go over down here. Well, actually, let me write in a cost here. Most people are going to be paying $185 for Medicare Part B. I'm just going to put that in here so we can get us like kind of an overall cost going. So right now, so far out the door, per month for our health insurance, we're already spending $185 by having Medicare Part A and B. I'm assuming, obviously, you're filing a joint tax return or individual tax return under the amount shown here on this table. Okay. So now let's talk about what your choices are. Well, you can go this side or you can go this side. On this side, you're going to keep Medicare Part A and B as your primary, and then you're going to add a Medicare supplement plan, and then you're going to add a prescription drug plan. So the pretty commonly purchased supplement plan right now is the plan G, like George. And that right there is going to cost, let's just say it costs $180 a month for someone just coming onto Medicare. Okay. Well, we're gonna have to pay 180 a month for it, but why would we give an insurance company 180 a month to be the secondary, the supplement to our primary Medicare? Well, because after Medicare pays the leftover amount that you'd be responsible for, this $1,676, it's gonna pay that for you. So you won't have to pay anything when you go to the hospital. The other thing it's going to pick up for you is it's going to pay the 20% of your Part B coinsurance. So you are not going to have to pay this 20%. It's going to pay it for you. The only thing you're going to have to pay is this $257 annual deductible. See right here, it's got it listed. The only thing for a hospital and doctor that you're going to have to pay is you will still pay the Part B $257 deductible. Once again, your max out of pocket for hospital and doctor, if you have Medicare Part A and B and the Medicare Supplement Plan G, will be $257. It's pretty good, right? So now we've added 180 to our costs. We're up to about 365 in monthly costs though. Okay, but we've really minimized our cost at the doctor and at the hospital. And we've made it so we still have access to basically every doctor in the whole country that accepts original Medicare. And the most we're going to have to pay is $257 a year. So now the drug plan. Well, on the drug plan, there's only 16 plans available, and this really is the Achilles heel of Medicare. The drug coverage isn't great, but the cost is really between. Well, the cheapest plan right now is $1.80. The most commonly purchased expensive plan is about $115. The most commonly purchased plan is about $17. Medicare.gov does a great job showing these plans. We can get into more details with you on that. The brief summary of the plans is they have an annual deductible of $590. So when you get your prescriptions, if you get a brand name drug, you could potentially pay full price up to $590. And then after $590, they're probably going to pick up around 75% of the cost. You pay 25% of the cost until you spend a total of $2,000, and then you're 100% covered after $2,000. There's a variety of plans. Like I said, there's 16 different plans. When you talk to an agent, they'll help you narrow it down. They just type in the list of your prescriptions. You can also do it on Medicare.gov. You could type in the list of your prescriptions and sort the 16 plans by which one's going to be the best plan for you. By the time they add up all your prescription drug costs plus the cost of the plan, which one's going to have the lowest overall cost. It'll tell you, it'll put them in order. And that's what we have a program to do that too. We're happy to do that for you as well. But let's say here, let's just assume like about 80% of our clients are on this, maybe 70% are on this WellCare Value Script plan. It costs $17.40. And so here our total cost is going to be, we're at 180, so 365 plus 1740. Geez, I don't know what it is. I'm not gonna. So I think we're at 182.40. So I'm gonna, or 382.40. 382.40. Don't shoot me if that's not right, but that's going to be our total cost by the time we pay for Medicare Part A and B, plus the Medicare Supplement plan, plus the Part D plan. What's important to know about this supplement price is this goes up a lot. This 180 price, by the time you are 80, it's probably going to be, with inflation, Well, let's just say an 80-year-old signing up today, they're paying 370 or 360 a month for this Plan G. Okay, so this does go up over time. And then the next thing we have here is this, or so then your other option. Your other option is a Medicare Advantage plan. On this plan, this monthly cost for this plan is $0. Okay, and what it's going to happen is you're going to go to the insurance company or to a broker like me and say, hey, I've got Medicare. And then the agent's going to say, or the insurance company is going to say, hey, well, you could trade it in. You can make Medicare not primary anymore. We can have a private insurance replace Medicare's primary. Medicare will send the insurance company money every month on your behalf. The insurance company won't send you a bill. And then they will give you what's called a Part C Medicare Advantage plan. It'll be your only insurance. You'll carry one card, as opposed to on this side, you're going to have three cards: Medicare Supplement, and a prescription drug. On this side, you're just going to have one. It's going to cover your hospital, your doctors, and your drugs. Okay. And it's going to do it at very low costs. Like, so for example, these numbers on the left where you see 0, 0, 0, 0, 0, if you have an HMO plan, the costs are very low. Primary care will be 0. Urgent care will be basically 0. Specialist 0. Inpatient hospital 0. Outpatient hospital 0. Emergency room, around $100. The max out of pockets on these plans are usually like 1,000 or under. There's a bunch of these plans available. There's certain companies like Kaiser, Scan, all they offer are Medicare Advantage plans. You couldn't get a Medicare Supplement plan with them. They only offered these plans. And then what they do is, if you pick an HMO plan, you sign up with them, they get the money from Medicare, and then now they're going to help you pay for your health coverage. And then what they do is they sign a contract with a medical group. The popular medical groups around here are like Optum or Eminent or Pomona Valley. Those are the major ones. And so what happens is you get a primary care doctor within a physician group, and then they start referring you to specialists. And it's a low cost option. It can save you some money, considerable amount of money. If we look at the total cost, if you do the Medicare Advantage plan, it's only going to be $185. It's not only going to be $185 for folks turning 65, it's also going to be $185 if you're 80 coming on the plan. They don't change the price on you. So so right now, going straight on to Medicare, you save about $200 a month if you do the Medicare Advantage plan. They do offer a PPO plan through the Medicare Advantage plan, but generally it comes at higher copays and a higher max out of pocket. So like specialists could be around 40, urgent care around 40, inpatient hospital $395 a day up to a certain amount of days. These are all just kind of general ballpark numbers. You definitely are going to want to narrow this down with an agent. I just kind of want to give you your basic choices here. Okay. So, and also, not only does this cover your hospital and doctors, it includes drug coverage. And usually the drug coverage on these Medicare Advantage plans is better than the Medicare Supplement plan. Okay. Not only do the Medicare Advantage plans help you pay for these, copays like this, but they also, not only do Medicare Advantage plans keep your costs really low at the doctor and hospital, but they also help you pay. They give you a dental plan. They give you a vision plan. They help you pay for hearing aids. They usually always include a gym membership, but so do the supplement plans include a gym membership. They'll give you money to buy over-the-counter items. If you get a card in the mail saying, hey, we're going to give you $1,000 towards grocery, well, they're talking about a Medicare Advantage plan. Those are all Medicare Advantage plans. They give you these added perks. So why doesn't everybody go to a Medicare Advantage plan as opposed to a Medicare Supplement plan? Well, some people just want to make sure they have as much access to doctors as possible. And for that, we would need to keep Medicare as the primary and not go with Medicare Advantage plan. If you're okay, if you like your primary care doctor and you've been working with Optum or a local medical group and you're getting to the doctor you want to go to, and maybe you need better drug coverage or lower drug costs, Medicare Advantage plans are usually the people we see go, we usually see people go to Medicare Advantage plans in that situation. And a lot of the times, if we talk to somebody who's had a PPO plan before Medicare, they're usually choosing the Medicare Supplement plan. If we're talking to somebody who's currently on an HMO plan, a lot of times they're comfortable going with the Medicare Advantage plan and saving the money. So these are the two fundamental routes. Which way to go? It's gonna be your choice, obviously, and your preference. The first 12 months after you enroll in Medicare, they are forgiving. So let's say if you enroll in a Medicare Supplement plan, or let's say you enroll in a Medicare Advantage plan, and then for some reason you can't get access to the doctor you want to go to on that plan. You say, hey, I need to go back to original Medicare and get a Medicare Supplement. You do have a 12-month window to do that, with no questions asked. After the first 12 months, it's a little bit harder to go from a Medicare Advantage plan to a Medicare Supplement plan. They're usually going to want to ask for medical questions to see if you can get over here. But on the left side, our total cost is the Medicare Supplement, the premium option, you're going to pay around $382. On the right side, we're paying around $185 for the Medicare Advantage option. I hope this is helpful, guys. If you have any questions, please, you can reach out to us directly at 626-963-3244. We'd love to go over your personal situation. My dad, Kirk Warner, has developed a team of agents, I being one of them. We have 4 other agents in the office who are happy to help, and we'd love to answer your questions. We're right downtown Glendora, and we'd love to talk to you soon. Thanks for your time.